hepatitis A, B, C, D, E. What are the differences and what are the symptoms, maybe, if you want to indulge in that?
Okay, hepatitis A and E, they are very common in our society and they spread through contaminated water or food. And they lead to some kind of a liver damage. And by and large, the liver damage is not severe. It's kind of a self-limiting. The patient will get some aches and pains, a bit of a fever, and in the second week they get some jaundice. And in 2-3 weeks time the things start settling down, and in about 4 to 6 weeks time it should be back to normal, because whatever the liver is damaged by these viruses, liver has the amazing capacity to regenerate and repair this damage. So in, I would say, 98% of the times with hepatitis A and E, your liver damage will correct
Regenerate.
itself.
Yeah.
And there will be no signs as if you have any liver damage in the due course of time. So these are hepatitis A and E. So they lead to short illness for a short period of time, and majority of the cases, liver recovers back to absolute normality. In 2% of the cases, the liver damage is so severe that the liver fails completely. And in those 2%, you actually need a liver transplant to save the life. We don't have the exact statistics that how many people get hepatitis A and E in our country. The other form of hepatitis is hepatitis B, C, and D. They are a kind of viruses which lead to a low-grade chronic damage to the liver. You might have acquired these infections at some point, and these spread through the blood contaminated products. Either if you have transfused with blood, or you got a contaminated needle, or you got some treatment from a dentist which uses contaminated instruments, and these sort of things. So these are blood-borne infections. So once you got the infection, it remains silent for a good few years, keep on giving your liver a bit of a slow damage, which may not be recognized at that stage.
Thank you.
But over 10 to 15 years, your liver is slowly getting damaged and replaced by a scar tissue. And eventually, after 15-20 years, the liver actually shrinks down, which is called liver cirrhosis. And that stage is not reversible. And that means the liver has been damaged permanently.